Connecticut is known as one of the wealthiest and healthiest states in America, but residents in its 5 largest cities live in some of the most concentrated pockets of poverty in the U.S. Here in the capital, Hartford, that poverty coincides with pollution, poor living conditions, and a childhood asthma rate of 20% that disproportionately affects children of color.
I have a bad cough and it hurts my body.
The youngest are often most at risk. Catherine Manson struggles with managing the severity of her children's asthma on a daily basis.
I never knew that you could die from an asthma attack. That's the seriousness of it.
Manson was confronted with that possibility when her son Carter had an asthma attack at a friend's birthday party.
So I literally had to pick him up, and he just kept saying, I can't breathe, I can't breathe. He's crying. And I'm just like, okay, just breathe, just breathe. Sorry. It was scary. That was awful.
Compared to white peers, black children and teens are more than 5 times as likely to go to the emergency room for asthma.
The reason that I believe that we have such high rates of asthma in Hartford is because of air pollution, both traffic-related air pollution and industrial air pollution.
For decades, the city of Hartford operated this trash incinerator, burning garbage from more than 70 nearby towns. It finally closed down earlier this year. Less than a mile away is a sewage sludge incinerator that was the cause of a pollution violation in 2021.
The rates of asthma were directly proportional to distance from the trash incinerator.
Within blocks of these industrial areas happen to be homes. People would claim it's an industrial area, but there's residential zones all through that. So people live by there.
More specifically, people of color live nearby.
The greatest predictor of where trash facilities in Connecticut goes is the percentage of people of color in that community.
Okay.
Nearly 4 in 10 black children live in areas with poor environmental and health factors, compared to 1 in 10 white children. In Hartford, more than 70% of the residents rent rather than own their homes.
When landlords are allowed to operate with absolute impunity and you stick this poor housing in the middle of industrial areas, you just have this whole recipe for disaster.
The multifamily homes and apartments are also dated, with issues of mold, asbestos, and other triggers for asthma.
So there are many, many issues with trying to address the livability of an apartment so that they're warm in the wintertime and they're safe for children, both from lead and from mold and asthma.
We don't lean on the landlords to make sure that their homes are taken care of. We lean on the mothers and tell them that they've done something wrong. As a black woman who is also a black mother, I have experienced ridiculous amounts of blame and abuse from a larger system that understands that they're culpable, but understands that the issues are so big that it's a whole lot easier to say, black mama, you're the problem.
It's clear that there is systemic racism. I don't think that they said, well, let's try to get the people of color and try to put trash incinerators there and come up with an excuse for that. And I don't think that there's a racist on the steps of the Capitol saying, let's have all toxicants go to communities of color. But the rules and the processes that are in place tend to make that happen.
State and federal initiatives have slowly been gaining traction to address the high rates of asthma in cities like Hartford through housing and health grant programs. But for now, advocates continue to raise the alarm on environmental racism and the health risks it creates.
I've already got asthma. 2 out of 4 of my kids have asthma. Now I just have to hope I can prevent it for my grandchildren.
Noreen Nasir, The Associated Press, Hartford, Connecticut.